12-lead ECG is an important cardiac diagnostic investigation. It needs to be performed by a trained, competent staff member to ensure an accurate recording of the patient's cardiac electrical activity. There are different machines in use across the Trust. This video focuses on the MAC 2000. Please familiarise yourself with the device in use in your area. As a direct clinical care procedure, please ensure you meet all infection prevention and control and uniform policy guidelines prior to taking the ECG. This video can be viewed by those learning to take ECGs or those who have already received training and wish to refresh their knowledge. It should be noted that only those identified as competent within their clinical area should perform ECGs. Introduce yourself and consider whether a chaperone is required. Confirm the patient's name, date of birth, and unique patient identifier, for example their NHS number, and enter this into the ECG machine. Explain the procedure to the patient and gain their consent. Ensure the patient knows that the procedure is painless. Ensure that the patient is comfortably positioned in a semi-recumbent position. Your patient will need to be exposed from the waist upwards, so please consider how you maintain their dignity. This might include covering them once placement of electrodes has occurred. Clean limb and chest electrode sites. If necessary, prepare skin by cleaning with soap and water or clipping hairs to ensure good contact between skin and electrode. Limb leads are placed on bony areas of ankles and wrists. Sometimes you will need to use alternative positioning based on your patient's anatomy. Precordial chest positions are very specific. V1 is placed in the fourth intercostal space close to the right sternal border. V2 is placed in the fourth intercostal space on the left sternal border. V4 is placed in the mid-clavicular line in the fifth intercostal space. V3 is placed midway between V2 and V4. This will place it on the fifth rib. V5 is placed on the anterior axillary line on the same horizontal line as V4. V6 is placed on the mid-axillary line on the same horizontal line as V4 and V5. Attach the cables from the ECG machine to the electrodes, checking that the cables are connected correctly and to the relevant electrode. Most machines are colour-coded, and you could use a mnemonic to help remember the correct limb lead placement. For example, ride your green bike. Ensure that the cables are not pulling on the electrodes or lying over each other. Ask your patient to relax, breathe normally, not talk, and refrain from movement during the procedure. Wait for the trace to settle so there is no artifact or baseline movement. This may take up to a minute. When ready, press the start button. Review the printout is satisfactory and has correctly recorded the patient's details. Ensure your name and the date and time is also recorded on the printout. Also include any diagnostic information, i.e. if the patient has chest pain during the recording, and deviations to the standard electrode placement. Once you have a trace you are happy with, inform the patient that the procedure is complete and help to remove the electrodes. Inform relevant staff that the ECG has been completed. Show the recording to the person who will analyse the recording. File the ECG recording in the appropriate documentation. Don't forget to clean and store your ECG machine appropriately.